Hey everybody, it's Shelby. And today we're going to be doing Interactive Case Study 5, which is about Vitobacterin, also otherwise known as Sabril. So the description for this week is that Vitobacterin, sold under the trade name Sabril, is commonly used treatment for epilepsy. This final form of GABA is a known inhibitor of GABA aminotransferase. GABA inhibitory transmitter is often underproduced in patients experiencing seizures. And as you can see on the right here, we have the chemical structure of the drug Vitobacterin. And yeah. So this drug is commonly used to treat epilepsy in mostly infants. So not normally adults, but little babies that are pretty young. So it is the fourth most common neurological disorder in the world. It is not a disease, it's a disorder. That's very important to note. And it's basically when surges of electrical activity in the brain cause frequent seizures, and we will get into what seizures are in a little bit. 7 out of 10 cases of epilepsy, there's no exact cause that can be found. So over the majority of the time, scientists and doctors don't even know what the cause of epilepsy is. And it affects all ages and sizes and ethnic groups and all of that stuff. So it's pretty common, really. And I think the statistics are that like 1 in 10 people will get a seizure in their lifetime, and 1 in 26 or so will develop epilepsy to some degree within their lifetime. And there is no way to prevent epilepsy. That's very important to note. It's also a scary point to note. But yes, there's no way to prevent epilepsy. So, as we talked before, we're talking about seizures. So what are they? A seizure, in this quote by the Epilepsy Foundation, a seizure is an abnormal release of electrical activity in the brain that causes temporary changes in how a person moves, feels, or thinks. There's 2 types. So there's focal seizures, which is one area of the brain, as you can see on the left side of this diagram, or there's generalized seizures, which are multiple areas and sometimes the whole brain. And whenever this happens, it can either cause whole body convulsions, which is what most people think of when we think of seizures, but it also can do like changes in their awareness or their behavior. Like sometimes they'll just sit there and space out. Sometimes they kind of can do other things too, and it can last for a few minutes or seconds. I do have a friend that has a seizure disorder, and sometimes hers can last pretty long. And she's on some different meds other than the one we're talking about. But yeah, they've gotten a lot better, so that's good. And it's important to note that where the seizure occurs in the brain determines what the body is doing. And the brain is divided up into different sections, also hemispheres, so right and the left. And each hemisphere in each area of the brain controls different things. So, the causes of epilepsy. There is no preventing this, but head injuries, high fevers, brain tumors, genetic factors, poisoning, congenital effects, other serious illnesses like meningitis, and sometimes we don't know, which is pretty scary. But yeah. So what is GABA? GABA was that neurotransmitter that we were talking about earlier. So GABA stands for gamma amino butyric acid. GABA. GABA. It's an inhibitory transmitter. And transmitter is a chemical messenger in the brain. A neurotransmitter. It slows down the brain by blocking signals, which we will get to later. It increases a cell's ability to receive, create, or send chemical messages to other nerve cells. It's a non-protein amino acid neurotransmitter, and it also is important to know that it produces a calming effect. It can help with anxiety, fear, and stress. So in the veterinary medicine world, which is the world I'm most familiar with, we use GABA quite frequently, actually. We use GABA for certain surgeries, especially like amputations and ACL surgeries, is because not only does it produce a calming effect so the animal can remain calm while it's in recovery, it also helps with nerve pain. And whenever you just got your leg amputated, you don't want to feel any pain because there's so many nerves there that we unfortunately had to cut. So that's why we use GABA, and we also use GABA for certain animals that come into the clinic that just need kind of just to be zoned out and just need to be kind of relaxed for our safety and their safety, the owner's safety, everything. So yeah, we use GABA mostly in a pill form in the veterinary medicine world. And there's the chemical structure on the right here. So the mechanism of action of GABA, as you can see, here's a synapse, and then all the little neurotransmitters, and then everything else right there. So it's part of the central nervous system, or CNS. And then so central nervous system, and then that goes to GABA A and GABA B, which are receptors on the nerve cells, which is right over here. And then GABA binds to them, and then it decreases the responsiveness and calms things down in the brain. So whenever it binds, it slows things down and allows everything just kind of to calm down, which is what we want. We don't want a lot of electricity in the brain, because that just causes more seizures. So now that we know what GABA and epilepsy and seizures are, now we can talk about vidabatrin, or Sabril, which is a drug used to treat seizures in infants. It's an anti-epileptic, which is an anti-seizure med. It was first approved by the FDA in 2009 for the US, but Europe and Canada and other places like that, they've been using this for decades. But we didn't get into the US until 2009. It raises levels of GABA. That's what this drug is supposed to do. When it comes in a powder or a tablet, and it's recommended to take it orally twice a day, in one of those two forms. So the knockdown of GABA via vidabatrin. The goal of this is to increase GABA in the brain to prevent seizures. It's a competitive inhibitor of GABA transaminase, which breaks down GABA. And obviously we want more GABA, so if we can inhibit the breakdown from transaminase, then we can produce more GABA, which can help prevent seizures. With no breakdown, GABA levels in the brain just continue to increase, or with breakdown. Yeah. GABA A is the main target, which is one of those receptors on the nerve cells. It is also a gamma amino acid, but just with a gamma vinyl GABA structure. It's an analog of GABA and irreversibly inhibits the enzyme associated with GABA. GABA T is the same thing as the transaminase. Adverse effects of this drug. Permanent vision loss, which is pretty scary. Eye damage, sleepiness, dizziness, double vision, blurred vision, abnormal coordination, and nausea. There's like a whole list of different things that this drug can do to people, but these are kind of the most common ones that I saw. And now we're going to talk about the structure of this drug. So, as you can see, it has a bunch of helices and ribbons, and then if you can see this little yellow square right here, that is where I think the it binds to the receptor instead of GABA transferase binding to the receptor, and there's a better picture of it right there. And then there's a bunch of just helices and all of that stuff around alpha helixes, and essentially what that does is I think allows it to competitively bind to that neurotransmitter instead of GABA. That way GABA transferase can't break down more GABA, which then increases GABA in the brain, which is what we want. Yes. Anyway, there are my references. Yeah, thank you.